Welcome back to the Wound Care Microlearning Series for nurses. Today, we're covering one of the most important topics in wound care, pressure injuries. You may also know them as pressure ulcers or bed sores. No matter you're studying acute care, long-term care, home health, accurate identification and staging are essential. When we understand why pressure injuries happen, we can treat them more effectively. What is a pressure injury and why it happens? So let's start with the basics. A pressure injury occurs when prolonged pressure cuts off blood flow to the skin and deeper tissue. Without oxygen and nutrients, tissue becomes damaged and begins to break down. Common sites include the sacrum, heels, elbows, hips, ischial area, and the back of the head. Now let's look at key risk factors. Immobility, moisture from incontinence or sweating, poor nutrition or dehydration, friction and shear, especially when the patient's sliding down in the bed, and decreased sensation, which prevents a patient from shifting their weight. Staging pressure injuries. Now let's walk through the staging system. Staging is based on the depth of tissue damage. So stage 1, the skin is intact, there is non-blanchable redness. It may feel warmer or cooler, firmer or boggier than the surrounding skin. Stage 2, there is partial thickness skin loss. The wound bed is pink or red. This may appear as a shallow ulcer or ruptured blister. There is no slough at this stage. Stage 3, full thickness skin loss. Damage extends into the subcutaneous layer. Fat may be visible, but bone, tendon, muscle are not exposed. Underlining or tunneling may be present. Stage 4, full thickness tissue loss with exposed bone, tendon, or muscle. Slough or eschar may be present. These wounds carry a very high risk of infection. Unstageable. The wound is full thickness, but the wound bed is completely covered by slough or eschar. You cannot determine the true depth until non-viable tissue is removed. Deep tissue injury. So this is a purple or maroon area. It's either intact or blistered. This indicates deep tissue damage beneath the surface. Nursing assessment. Let's talk about assessment and what nurses should document. Inspect all bony areas daily. Document the stage, size, and depth. Note tissue type, the amount and color of exudate, and the presence of any undermining or tunneling. Assess pain and monitor changes over time. Interventions. Reposition the patient at least every 2 hours or more frequently if needed. Use offloading devices like heel protectors, cushions, and low air loss mattresses. Keep the skin clean and dry, and use barrier creams to manage moisture. Choose dressings that support moist wound healing, and always assess contributing factors such as nutrition, mobility, continence, and comorbidities. Interdisciplinary teamwork is essential, so make sure to collaborate with PT, OT, dietitians, physicians, and wound care specialists to create that comprehensive plan. Pressure injuries are preventable when we understand how they form and when we recognize early changes in the skin. Staging accurately guides treatment and protects your patients from complications. And here's the key point to remember. No pressure injury can heal if pressure is still being applied. Just like a bruise won't fade if you keep pressing on it. Tissues can't recover when blood flow remains restricted. This is why pressure redistribution is the foundation of both prevention and healing. Every dressing, mattress, and care plan only works if pressure is relieved first. Thanks so much for joining me in this microlearning session, and be sure to watch the next lesson on moisture-associated skin damage. Let's keep building your wound care knowledge one lesson at a time. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.